Welcome to the deep dive. Today, we're going to be exploring this case study from veterinary radiology and ultrasound about a 7-week-old American bulldog puppy that presented with a brain abscess. And this case is super interesting because it involves using a CT-guided drainage procedure, which is the first time it's ever been done in canines.
Yeah, this really showcases how much vet neurology is advancing. It's even more interesting because the patient was so young and there were so many complexities around diagnosing and treating such a serious condition in a puppy.
So let's start with how she first presented. The puppy was found by the side of the road with a head injury. There was some fluctuant swelling and puncture wounds with seropurulent discharge.
Yeah, initially they treated her with buprenorphine for pain and amoxicillin clavulanic acid to address any possible infection. But the next day, things took a turn for the worse when she started having seizures and her behavior changed.
Oh, wow. That must have been really concerning for everyone.
Yeah, for sure. The neurological exam showed a lot of concerning findings. She was disoriented, obtunded, which means a reduced level of alertness, and had left-sided postural reaction deficits. She also had an absent left palpebral reflex, a delayed bilateral vestibulo-ocular reflex, absent menace responses, and calvarial hyperesthesia, which is sensitivity to touch on the skull. All these findings indicated a significant neurological problem.
So knowing all that, how did they proceed from there?
Well, given how serious her condition was and how urgent it was, they decided to do a CT scan instead of an MRI. CT scans are faster and more readily available in emergency situations, and they're particularly good at visualizing bone, which was important considering the possibility of a skull fracture in this case.
Makes sense. So what did that initial CT scan show?
The scan showed a depressed skull fracture in the right frontal bone, and it also showed an intraparenchymal lesion in the left frontal lobe. This lesion looked hypoattenuating with a hyperattenuating rim and surrounding edema. That suggests it was an abscess. There was also evidence of midline shift and cerebral edema, meaning her brain was being compressed and swollen.
Wow. Those are serious findings. So what did they do to treat her at that point?
Initially, they went with a conservative approach, focusing on managing her symptoms and giving her broad-spectrum antimicrobial coverage. This meant giving her a fentanyl CRI for pain management, levetiracetam to control the seizures, meropenem for nausea, and a combo of amoxicillin clavulanate, metronidazole, and clindamycin to target a wide range of potential bacterial infections.
So basically they were trying to stabilize her and address the infection with meds.
Exactly. But even with all that, her condition didn't get much better.
Oh no. What did they do then?
After 72 hours of this conservative treatment and very little improvement, they did a second CT scan to reevaluate what was going on.
Okay, and what did this second scan show? Was there any change?
Unfortunately, the second scan showed that things were actually worse, the lesion had gotten bigger, and the surrounding edema and mass effect had gotten worse.
So the conservative approach wasn't working like they'd hoped.
Right. And that's when they decided they needed to try something more invasive.
Okay, and that's where the CT-guided drainage procedure comes in, right?
Precisely. Based on that second CT scan, they realized the abscess wasn't going away with just medication, so they decided to do this minimally invasive drainage procedure. And this is where things get really groundbreaking.
I'm definitely interested to hear more about this procedure. Can you walk us through how it works?
Sure. So using CT guidance, they were able to target the abscess very precisely and insert a needle to drain out the pus. This way, they could avoid doing more invasive surgery, which could have been really risky for such a young puppy.
Wow, that sounds incredibly precise.
It definitely was, and it was a much safer alternative to traditional open surgery.
Okay, so let's go back to that CT-guided drainage procedure. Can you walk us through how they actually did it?
Yeah, so they sedated the puppy and prepped the surgical site, and then they used a combo of anatomical landmarks and real-time CT imaging to guide a spinal needle through that skull fracture and into the abscess.
Wow, that sounds super delicate. Could they actually confirm that they were in the right spot?
Oh, yeah, they could. The CT images let them see the needle right there in the brain and make tiny adjustments to make sure it was in exactly the right place inside the abscess. And once they were sure the needle was positioned correctly, they just let the pus passively drain from the abscess.
And did they take any samples during the procedure?
They did. They collected a sample of that pus for culture and sensitivity testing. That was important to figure out exactly which bacteria were causing the infection and what the best antibiotics would be to treat it.
That makes a lot of sense. So they grained the abscess, got a sample, and then what? Did they close up the incision?
Actually, no. They decided to just leave the bone fragments from the fracture in place and not do any surgical repair. They made this decision because she was so young and her skull was expected to heal well on its own. Plus, doing more surgery in an area that was already infected could have caused complications.
I see. So how did they deal with the swelling in her brain?
To manage the cerebral edema, they gave her hypertonic saline and dexamethasone. The hypertonic saline helps draw fluid out of the brain tissue, which reduces the swelling. And the dexamethasone is a corticosteroid that helps reduce inflammation.
Okay, so they addressed the infection, drained the abscess, and got the swelling under control. What about pain management and keeping her on antibiotics?
Yeah, so they kept her on buprenorphine for pain relief, and they adjusted her antibiotics based on those culture and sensitivity results. The testing showed that she had small alpha-hemolytic gram-positive cocci, but they couldn't pinpoint the exact species.
Did that make it hard to choose the right antibiotics?
It didn't, actually. Luckily, the sensitivity testing showed that the bacteria were susceptible to doxycycline, metronidazole, and clindamycin. So even though they didn't know the exact species, they were able to give her antibiotics that would effectively target whatever bacteria was causing the abscess.
Yeah, that's good news. And how did she respond to the procedure and the new antibiotics?
Well, this is where you really see how resilient puppies are. Within just 48 hours after the drainage, she was doing so much better. Her mentation improved drastically, she was more alert and responsive, and she even started eating again. By day 3, she was vocalizing and interacting with everything around her.
That's incredible. It sounds like the procedure was a complete success.
Yeah, it really seems that way.
Yeah.
And she just kept improving. Just 4 days after the procedure, she was walking on her own, even though she had a little ataxia, meaning her movements weren't perfectly coordinated yet. After 6 days, she was discharged from the hospital.
That's amazing. So she was able to go home, but they kept her on treatment.
Right. She went home, but she had to keep taking the antibiotics and levetiracetam, which is an anti-seizure medication, for 8 weeks. And they scheduled follow-ups to keep an eye on her.
And how did those follow-ups go?
The follow-up visits, 1 week and then 7 weeks after the procedure, showed that her physical and neurological exams were completely normal. That's a great sign. And after 6 months, since she kept doing so well and didn't have any seizures, they stopped the levetiracetam.
Wow, puppies are so resilient. It's amazing.
It really is. And, at the time they wrote the case report, which was 20 months after the procedure, she was still doing great and thriving.
That's such a happy ending. But why is this single case so important? Why are we even talking about it on the deep dive?
Well, this case is a big deal because it's the first time anyone's ever successfully used CT-guided drainage to treat a brain abscess in a dog. It's really exciting because it opens up all sorts of possibilities for treating cases like hers in the future.
Yeah, it sounds like this could change the way vets treat brain abscesses in dogs.
It definitely could. This minimally invasive approach has some big advantages over traditional open surgery, like causing less trauma to the brain, having a faster recovery time, and a lower risk of complications.
But, this is just one case. How do we know for sure that it will work for other dogs?
You're right, it's true. More research is definitely needed to be sure it's effective and safe in a wider range of dogs. Different breeds, ages, and severities of brain abscesses.
And it seems like this procedure needs special equipment and training. Do most vets have access to those resources?
That's a good point. Not every veterinary clinic has a CT scanner or a neurologist who can do this kind of delicate procedure. For it to become more common, more clinics would need access to those resources and training.
So even though this case is amazing and shows a lot of promise, there are still some practical challenges to figure out before it becomes the go-to treatment.
Exactly. But even so, this case is a huge step forward for veterinary neurology. It shows how much progress is being made and the potential for less invasive and more effective treatments for animals with really complex neurological problems.
It also shows how amazing the brain is at healing, especially in young animals. The report mentions how important neuroplasticity was in this puppy's recovery. Could you tell us more about that?
Expert speaker.
Yeah. Neuroplasticity is the brain's ability to reorganize itself and form new connections throughout life. And this ability is really strong in young animals whose brains are still developing. In this case, the puppy's young age probably played a big part in her amazing recovery. Her brain was basically able to adapt and compensate for the damage caused by the abscess and the treatment. So her brain was basically able to rewire itself and regain function, even after such a serious injury.
That's exactly it. That's what's so amazing about neuroplasticity. It shows us how incredible the brain's potential for healing and recovery is, even with serious neurological problems.
This case also makes you think about the connection between traumatic brain injury, or TBI, and the risk of developing epilepsy. Can you explain that link a little more?
Sure. TBIs, like the one this puppy had, can mess up the brain's normal activity, and that makes it more likely that the dog could develop epilepsy later on. Epilepsy is a neurological disorder that causes recurrent seizures, and the risk of developing epilepsy after a TBI is even higher when there are depressed skull fractures, like in this case, because those bone fragments can irritate or even damage the brain tissue.
So this puppy was more likely to develop epilepsy because of her head injury.
Yeah, exactly. And that risk can last for months or even years after the initial injury.
So how did the vets manage that risk in this case?
Well, to be on the safe side, they put her on levetiracetam, which is an anti-seizure medication, for 6 months as a preventative measure. This was to try to lower the chances of her developing epilepsy. But of course, there's no guarantee that meds can totally eliminate the risk.
So they were being cautious, considering the TBI could have long-term consequences they couldn't predict.
Exactly. And the good news is she didn't have any seizures during those 6 months, so they were able to stop the medication. But they did tell the owners to watch for any signs of seizures and to get veterinary care right away if they saw any.
That makes sense. They had to balance managing the immediate risks with the potential long-term complications.
You got it. And cases like this show just how important open communication and careful monitoring are.
Before we wrap up, I wanted to talk about Table 1 in the report, which summarizes other cases of canine brain abscesses from veterinary literature. What are some of the main takeaways from that table?
Well, Table 1 is really helpful because it puts this case into context. It shows us that canine brain abscesses can be caused by all sorts of things, like bite wounds, foreign objects that penetrate the skull, infections that spread from other parts of the body, and even weakened immune systems.
So it's not always easy to diagnose.
You're right, it's not. The table also highlights the different ways vets have treated these cases. Some dogs get treated with antibiotics and supportive care. Others need surgery to drain the abscess. And as we saw in this case, some can be treated with minimally invasive techniques like CT-guided drainage.
And what about how the dogs did after treatment?
The outcomes in the table are all over the place. Some dogs made full recoveries, some had lasting neurological problems, and sadly, some didn't make it. This just shows how serious brain abscesses are and how important it is to get the right treatment quickly.
It also shows how important it is for veterinary medicine to keep researching and developing new treatments to better diagnose, treat, and improve outcomes for dogs with brain abscesses.
Absolutely. This case is a perfect example of how things are moving forward. It shows the potential of minimally invasive techniques and how resilient the brain can be, especially in young animals.
This has been such a fascinating deep dive into a complex and groundbreaking case. It's really amazing to see how new technology in veterinary medicine is being used to save lives and improve the lives of animals. But I guess the big question is, how will this change how brain abscesses in animals are treated in the future? Will CT-guided drainage become the standard of care, or are there things that might prevent that?
Well, that's the crux of the matter, isn't it? This case definitely suggests that CT-guided drainage has the potential to revolutionize how we treat these cases. But, as we talked about earlier, there are some limitations.
Yeah, we talked about how it needs special equipment and expertise. But what else might make it hard to use this treatment more widely?
One big thing is cost. CT-guided drainage requires advanced imaging and specialized vets, which can be really expensive. Not every pet owner will be able to afford it.
And even if cost wasn't a factor, not every vet clinic has a CT scanner or a neurologist who's trained to do this.
Exactly. Where you live and whether you can get to a referral center that can do this procedure makes a difference. For pet owners in remote areas or who don't have access to specialized veterinary care, this treatment might not be an option.
So while it's promising, not everyone can get it. Are there any risks or limitations with the procedure itself?
Well, every invasive procedure has some risk, like bleeding, infection, or damage to the brain tissue around the abscess.
And even with CT guidance, there's always a chance something could go wrong.
For sure. And how well the procedure works also depends on the abscess itself, where it is, how big it is, and how thick the pus is. All those things can affect how well the drainage works.
So it's not a magic bullet that works for every case.
Yeah, that's important to remember. It might work better for some types of abscesses than others. We need more research to figure out which cases are best suited for CT-guided drainage.
So it sounds like there are lots of things to consider, both practical and medical.
Exactly. And this is why we need more research to refine the technique, see how it works long-term, and find ways to make it even better.
Even though there are challenges, this case is a big step forward in veterinary neurology. It gives us hope that there are less invasive and more effective treatments out there for animals with these really serious conditions.
I agree. It shows how much veterinary medicine has progressed and how dedicated vets are to pushing the boundaries of what's possible.
And on that note, we wrap up this deep dive into veterinary neurology. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.